right, so we are going to be taking a bite registration for our patient. This is the auto mix gun that you learned about in lecture. Sometimes it'll be halfway like this. If that's the case, you're going to push this button right underneath and you're going to pull it all the way back. If it is not flat, you will not be able to get the cartridge in. You're going to lift this lid. This is the bite registration cartridge. It has a little triangle. You have to line that up and it's going to snap right into that. All right, and then there's a key right here. There's a little triangle. You're gonna turn that to the side and pull it straight out. You then will get a brand new tip. There's a triangle on this tip. You line it up on the side right here, slide it in, and then you twist it like a key clockwise to lock it in, okay? Always give a quick tug because sometimes if you forget to lock it, when you go to extrude the material, it will blow off the top and you'll have material everywhere. So give it a quick tug, make sure it's nice and snug, okay? We always bleed the material to make sure that it is fully usable, okay? So you're gonna come over to your paper and we are going to, and sometimes you can push this to get it if your cartridge is used a little bit. So we are going to bleed the material until it's nice and blue. That's how it should look. Then we're gonna come over to our patient. We are going to do a zigzag motion. And you want to like overshoot the teeth. So you want to pass the teeth, zigzag, 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 and then you can go straight in the front. And then I'm going to come back over here and start over. I find when you're learning, it's best to connect them rather than keep going in one straight line. Those spots that are always low are the canines, so you can go back and do that. Then you're going to have your patient say bite and your normal bite, please, and hold. All right. And then while they're sitting like that, you can take off your tip. You have to get rid of the tip every time, even if you do a retake, because the material will set in here. Again, you see the triangle on the top. You will turn it to the side and you will pull it out, okay? And you will set it over here, and then you wipe down the cartridge and you cabbie wipe the auto mix gun, okay? To get it out, you will lift the lid and you will pull this straight out and it will come out, okay? And then we will wipe this and you can cap it. You will then, if you put the cap back on, then we will then wipe the whole thing after. Okay? Always make sure that you do not set your cap face down on the tray paper that has saliva. Always put it off the side. As you can see, I have everything off to the side here, and then we will wipe this down, but always put the cap on the side. All right, we're gonna come back over because this sets pretty quick. It's almost there. We're just gonna poke it until it's nice and rubbery. We're gonna give it just a little bit longer. And again, there's two different techniques. So you can, as you can see, this is directly on the teeth. In lecture, I talked about you can put it in a tray and then you would have your patient bite on the tray. Either one will get you a bite registration. This is just the most common technique that offices use. So I would say we're almost there. Let's just give it about 10 more seconds. Okay, that's good. You're gonna have your patient open nice and wide. Perfect. Use two hands because you don't want to tear it. And we're going to pull it out here. And then we're just going to look to make sure we have everything. So we have the back molars, and on this side we have all of the teeth there. Probably going to put a little bit more on the canine there, but that looks good. We have everything that we need. And then again, you will spray this. As we talked about in lecture, you do not have to wrap this in paper towel because it is stable for up to a week. We can just set it down after it's been disinfected. Okay, and that is bite registration. Thank you.